Hi, I'm Dr. Jed Horowitz, and I want to thank everybody for coming here today. I'm sorry we can't be here with you, but you'll have a great presentation and a lot of interesting information. So thanks again for coming.
Hi, my name is Nichter. I'm a plastic surgeon, obviously, here at Pacific Center for Plastic Surgery. And I wanted to thank everyone for coming today, and I'm so sorry I can't be with you personally. The LiteLift is a modified facelift, which has a lot of advantages. It has about 40% less scarring than a traditional facelift. It's a quicker procedure, which also means it's a fast recovery. And the best thing about it is it gives a very natural appearance, not a swept away appearance, and basically with a very quick recovery time.
The best candidates for a LiteLift are men or women who are healthy, who show signs of aging in their lower face and neck, and have realistic expectations about what they can achieve from the procedure.
Well, mini facelift is really just a wastebasket term for a whole bunch of different procedures. And unfortunately, a lot of people that are less trained or not, and certainly not plastic surgeons, are doing these procedures under the quotes guise of a mini facelift. And many of these rely on just redraping, minor undermining, just redraping skin, and you would probably get a very nice appearance for a very short period of time, but certainly not longevity.
The LiteLift is a quicker operation, and it has quicker healing than a traditional facelift, but it seems to be as long-lasting as a traditional facelift because of the techniques that we use.
The most common question we're asked is, how long is this going to last, the LiteLift? And the example I like to give is, it's going to last forever. Now, I know you're all going to roll your eyes back when you hear this, but I have identical twin boys, for example, and if one of them had this procedure and the other one did not, one would always look far younger. So you turn back the hands of time, but the clock keeps ticking. And you'll always look better than if you did not have this procedure.
The LiteLift procedure provides natural results for our patients. It lets you become a more rested, youthful version of the way you look now. It doesn't look windswept, it doesn't look pulled. There's a vertical lift that acts against the natural forces of gravity and aging.
The vast majority of our patients, in fact about 3/4 of them, will opt to have this procedure done in the office under local anesthesia with some Ativan, which is something that makes you sleepy and very relaxed. Most of our patients sleep for most of the procedure. However, comfort is the big word here, and we offer 3 choices to all our patients. We want all of you who have this procedure to be very comfortable. So we can do it under twilight anesthesia, which is some IV sedation. It can be mild or deeper. And we even offer general anesthesia for those patients that wish it. But the advantage is that's not necessary, it's just for your comfort.
It's important to understand the recovery process for a LiteLift. Most patients are recovered in 1 to 2 weeks. Many patients, if they're only having the LiteLift and not having eyelid surgery or any other procedures, actually look very good even in the first 5 to 7 days and can probably be in public within 7 days. As we add on additional procedures, that healing process may take a little bit longer. There may be some firmness in the area that has surgery, and obviously there's a small amount of swelling, particularly in the first week.
It's a nationally advertised chain of centers, not surgeons, but centers that do outpatient mini facelifts under local anesthesia. You're not given a choice. All of them are done under local anesthesia with some oral sedation. Also, many of the doctors are not board certified plastic surgeons. Some are not. Typically, from what I hear from my patients who have been to these consultations, are that you are not even seen by a plastic surgeon in most cases on the first appointment. In complete contrast, we're more of a boutique practice. We take very personalized care. You meet with your surgeon the first time. We spend an extensive period of time. And each surgery is absolutely individualized to your needs and what's required to give you a very natural result.
The LiteLift is a procedure that we have trademarked the name for, but it's a combination of a technique of doing the operation and the way in which we provide the anesthetic and the total care package that we present to our patients. So although other surgeons can do variations of short scar facelifts or vertical facelifts or other modifications, we're the only doctors who can actually do the LiteLift surgery as we have packaged it for our patients.
It's actually great to be in a practice with another well-qualified plastic surgeon. When we develop these techniques, we often develop them together. We do the procedures, the first several together, and we work on various techniques and nuances and are constantly discussing improvements in the technique. And that always keeps our learning curve very high and steep, but the benefits are really tremendous. And I think this is what allowed us to achieve this. The second aspect is we listen to our patients. Our patients forever have been telling us, do we have to have a general anesthetic? Do we have to have scars that go all the way behind your ears because they're telltale signs? I'm so worried that I don't want to look natural, that I may not look natural, and I've seen other bad facelifts where they have that swept away appearance. And we listen to all these, and we've tried to figure out how to achieve this. And I think all surgical specialties are trying to get at how can you achieve the same results but use more non-invasive techniques. And that's what we've achieved at Pacific Center for Plastic Surgery and how the LiteLift was developed.
The LiteLift as it is done today with the type of anesthetic that is done today has been done primarily in the last 4 years, but we started doing the actual technique, the actual surgical technique, more than 10 years ago. And Dr. Nichter and I have been doing facelifts of every type for over 25 years. We individualize every procedure we do. It's extremely common for you to age not just at the jawline and upper neck, but sometimes the neck ages a little bit faster, and sometimes people have these bands. We often do a neck lift with this, which is called a platysmoplasty, or tightening the neck muscles. Many patients are concerned that they're told they have a very tired appearance, and they want their upper or lower or both eyelids corrected. And also we often lift up the brow and do a temple lift, which again can be done through very small incisions behind the hairline. And lastly is, I mentioned that you previously that you actually age in 3 ways. One is laxity and gravity, and that's what the LiteLift and other lifts take care of. However, you also lose volume in certain areas. For example, the cheek area, when you get much older, the temple area. And also, many people have this little depression right on the side of the chin called a prejowl. And they can all be corrected with transferring fat, for example, which again restores the youthful volume that you once had. And lastly, the skin surface texture by both genetics and environmental factors. In California, it's a pretty harsh environment. Even though we're close to the ocean, it's really a desert. There's a lot of surface characteristics, brown spots, large pores, fine and coarse wrinkles. And we often do peels such as the blue peel, which is a very mild peel that we often do at the same time as a LiteLift without really substantially lengthening the recovery period. So you restore that nice smooth skin as well. When patients come to our office, we try to provide them with an outstanding experience in many, many ways. We want our patients to be very comfortable with all of our staff. We want them to be comfortable in our office setting. We want them to understand the procedures that they're going to have, the LiteLift. We want them to know what options they can have when they're having the LiteLift. Or maybe they don't need the LiteLift. Maybe they just need skin care or some other treatment at this point in their lives. We want to establish a relationship with this patient that will go beyond the initial visit and go beyond the surgery. It's important for us that when our patients come to the office that they're confident in the doctors, that they're comfortable with the staff members, and that they're just having an outstanding experience from the time they pick up the phone and call the office until they have their surgery and complete their surgery. We want to establish long-term relationships with our patients. Our patients are our primary focus.
The patients are so thrilled with our LiteLift that our practice has grown exponentially. In fact, it is the most popular procedure we perform, and the reason is happy patients. We treat you as members of a family. We spend lots of time counseling you and are also available through the recovery period, which is also extremely important. But most importantly, it's the patient's happy experience and them telling all their friends and neighbors and associates and people they meet. That's really what drives our practice and what makes it, such a wonderful place to practice. Thanks so much for coming. We really appreciate your time. If we can answer any further questions, please don't hesitate to come in and make an appointment and see us. Thanks so much.
I hope this short video was informational for you, and I hope you had a great time today. Our staff is amazing, and I'm sure they answered all of your questions, but if anything is left outstanding, what I'd like you to do is go onto our website. We have a huge amount of information there. We have videos, we have photos, and you can call the office with any questions that you have, or you can email us at our email address, and we'll answer any of the questions that are remaining. So thanks again for coming, and we hope to see you soon.